Hi, this is Jeff Zeig in Phoenix, Arizona at the offices of the Milton Erickson Foundation with another 5-minute tip for therapists. Let's think for a little bit about trauma. Trauma is a ubiquitous problem. Everybody sometime in their life is going to be traumatized, and most people have enough resilience that they're capable of overcoming trauma without therapy. As a matter of fact, as I understand, after 9/11 in New York, the most popular treatment was not psychotherapy. More people went to yoga to try to calm themselves, to try to soothe themselves. Now, there are many different schools of ways of working with trauma. Behavioral schools, cognitive schools, experiential schools, somatic experiencing. So many experts have their way of working with trauma. And what we might want to do is to be integrative experiential therapists, picking and choosing things that could work for us. Eye movement, desensitization, EMDR. So we have many different approaches that we can use in working with trauma that can increase our effectiveness. Now, when somebody's traumatized, they have a close brush with death. 30 days after, if they're experiencing symptoms in 3 areas, they can be diagnosed with post-traumatic stress disorder. The symptoms would be 3. Intrusions, where there would be sudden memories that would be happening that were inescapable of some of the horror that they relived. Social withdrawal, where somebody started moving away from the activities that gave them joy in life. And hypersensitivity, hyperreactivity. Now, one of the things that practically all schools of therapy would do is that an initial session informs somebody that their reaction is a normal reaction to an abnormal event. To have that constellation of withdrawal, intrusions, and hypersensitivity are normal when you've been exposed to a close brush with death. I could have them, you could have them, we could all have those symptoms happen to us. Then what we can begin to do is to understand how is it that we can help clients get symptom control. And symptom control can be something that we can create with hypnosis. Every hypnotic phenomena can be utilized. Put the person into a trance, find out what hypnotic phenomena the person could do best, and use that hypnotic phenomena to help the person to get control of symptoms. If the symptom was an intrusive memory and the person was capable of doing amnesia, then somebody can forget a memory. If the person is capable of doing hyperamnesia, they can have another vivid memory of something that happened in their childhood that they can use to block the uncomfortable intrusive memory. If the person is capable of doing age regression, they can go back in their memory and time before the problem happened. If the person is capable of doing anesthesia, they can numb the situation. If the person is capable of doing negative hallucinations, they can have a negative hallucination of the situation. So those of you who understand hypnosis understand that depending on the expert and how the expert categorizes it, there could be 12 different hypnotic phenomena. Basically, these hypnotic phenomena have to do with the plasticity of perception and sensation. We are not as locked into reality as we may think, and hypnosis becomes an avenue where people learn that they can be plastic in memory function, they can be plastic in their dissociative ability, they can be plastic in their perception, they can be plastic in the way in which they experience time. If somebody is good at time distortion, they can make pleasant things elongated, they can make unpleasant things shortened. We all have experience with time distortion. If you're waiting for a bus on a rainy day, it can seem like quite a long time for that bus to traverse one city block. So we all have experience with time distortion, and hypnosis, what we do is we take these phenomena of everyday life, we distill them, and we can use those as resources. Once we can help people to get symptom control, we can help them to understand meaning. How can they create meaning out of the tragedy that has befallen them? How can they use their tragedy as a stepping stone to helping other people, for example. How can they make use that as a stepping stone to knowing that they can deal adequately with any adversity? So the stages of working with trauma are to help people to normalize, to get symptom control, and to create meaning. You can look into the work, for example, of Don Meichenbaum in cognitive behavior therapy at the Melissa Institute, and you could learn more about his approach, Peter Levine, somatic experiencing, Bessel van der Kolk, and learn about their approaches, Francine Shapiro, EMDR, and arm yourself to be better able to help people who are suffering the residuals of trauma. This is Jeff Zeig, Phoenix, Arizona, and thank you so much.